So good evening, everybody. My name's Steve, and I'm from Safety Inspired Life in association with Achieve Training and Consultancy, talking to you from Dubai. Now, tonight's interview is going to be with one of the UK's frontline key workers who works as a nurse manager in the care home environment of the UK. So I'm super excited about this because we're going to get first-hand experience of the challenges that this individual's facing. And I'm also super excited to introduce you to Samantha Farahat because she's actually my sister. Okay, so Samantha, tell us a little bit about yourself.
Okay, so I am a qualified nurse. I'm also a nursing home manager for 2 nursing homes. I work for a care home provider here in the UK. I've been a qualified nurse for 10 years, and I'm very excited to be here and speaking to yourself, Steve.
Okay, so tell me about the challenges that you're currently facing in regards to waking up every morning knowing full well you're putting yourself and your family, your colleagues, your peers at risk facing this horrible pandemic, which is globally threatening how we exist. So just talk me through your day.
Okay, so obviously when you wake up in the morning, the first thing I do is look at the news, look at the any up-to-date information that's been has manifested overnight, and then the anxiety starts to kick in. Thinking, okay, I think about my family. Obviously, I've got parents that I don't see at the moment because of all the shielding that's going on, but I've also got a young family myself. So I have to mentally prepare myself. And the minute I step out of the front door every morning, I have to leave my family life behind me in my head and focus on going into the home to look after other people's loved ones. That's what I signed up to do as a nurse, not ever foreseeing the pandemic that we're experiencing at this moment in time. In my wildest dreams, I thought I would see. But I also have to be professional and set an example to the staff team that I lead, who have their own anxieties, who've got their own families. And it's a scary time. It's very, very scary. And also then we have got the anxieties of families who aren't able to come and visit their loved ones at this moment in time due to the lockdown situation. I don't tend to like to use the word lockdown, but it is a word that the government use. It does sort of like portray a picture of a prison situation.
Yeah, so there's been a lot in the media bandied around regarding the elevated challenges that care home workers like yourself are currently facing in regarding to automatically the people that you're looking after are super high risk for so many different reasons. So what are the various challenges that you're facing at overcoming these hurdles in regards to media impact on your organization, on yourself as an individual, and of course on your staff during this time?
Yeah, so obviously one of the biggest challenges throughout the whole of the care sector is the availability of PPE. I see myself as being very, very fortunate. My organisation that I work for has got an excellent supply chain, and we have never ever run out of PPE. They have developed an app which we input into on a daily basis, and that app is viewed by our procurement team, who are able to monitor our stock levels and send deliveries out automatically. Regarding challenges, my biggest challenge at the moment is with families. Families are showing great concern, obviously. Families are very, very scared of the unknown. And having to touch base with families on a daily basis. This virus, as we know, mutates consistently. So I have no resident that actually presents the same. So when we are liaising with GPs and out of our services and talking through the symptoms that people are showing, this can change on a daily basis because of it used to be the cough and the high temperature, and now we're looking at into things of like loss of taste, people being hypoxic but not outwardly showing the signs of hypoxia, but from their saturation levels that we can tell that that person is unwell. It's just unbelievable. Another challenge that I face is sadly with some GPs, in the sense, obviously our aim is to make everybody as comfortable as we possibly can, and act on the GP's advice regarding the particular resident. And if they feel that the resident is approaching their end of their life, whether it be through natural causes or whether it be through COVID, then they're leaving the conversations to be had with families, which is fine in a normal situation. However, because of all the hype over the COVID situation and the stresses and anxieties that families are feeling, not only do some families feel guilt of putting their person into a care home initially in the first place, they now have the anxieties and stresses of not being able to see that person. So my ask has been to GP practices to take 10 minutes out of their time to reassure families that we're doing everything we possibly can, and that anything that's put into place is purely and simply for the comfort and dignity of that resident. Now, like I said before, normally these conversations are had at home level, and residents' families are very accepting. But in these type of circumstances, they're not accepting of our explanation. They're not accepting that GPs are not willing, or not willing, but are looking at alternative ways to manage the person at the home, because until recently we've not done any testing. But now I am embracing with open arms that the ability to do tests at home level. And up until last evening, it was purely and simply symptomatic residents. However, now we are testing everybody, which I welcome with open arms. So going back to the GP scenario, I've asked for GPs just to spend 5-10 minutes just explaining the processes to the person's loved ones, because I feel that they would be more accepting of a GP's point of view. Because sadly, I can't tell whether, and the amount of phone calls that I get in a day saying, do you think my person passed away because of COVID-19? And at this moment in time, I'm having to say, I can't actually tell you. I wish I could. They were symptomatic.
Normally, that's not your job, is it?
No,
Normally it's not your job to tell them what they've died from, because
it's not.
invariably you wouldn't know at your level.
No.
But
But they're asking for, they want to know.
yeah, because
Understandably, they want to know.
communication structure, I guess with them, and generally at this moment in time, potentially you're the link man to them and the GP. Yeah,
Yeah,
well, really it should be them going directly to the GP, or the GP proactively feeding information to them.
yeah.
Now,
And that's what I've asked for.
about, we've mentioned regarding various media and their spin on this. Do you think that's causing extra levels of stress on you and your staff?
Yeah, absolutely. The media are portraying it, and it's very focused on care homes, especially as of today. The figures that have been released include care homes. Media just take it from one angle. Media don't look at the good things that nursing homes are doing in this current situation. They're just looking for the negatives. And like I said at the beginning, I see myself and my staff being very fortunate regarding our PPE levels. I see my staff coming to work like myself on a daily basis, and leaving their challenges from the home life behind them and their anxiety as best as they can. However, I have seen a high increase of staff sickness. Understandably, some people have developed symptoms, um, and now we're doing staff testing some of my staff haven't actually taken the staff testing uptake. And you then pose the question in your mind then, are they symptomatic or are they just scared like the rest of us? And it's okay to be scared. I understand why they're scared, and I can't force the hand to come to work. But then you're having to maybe bring agency care staff into your home who they've got the training and everything else to do with infection control and PPE and everything else, but they don't know your residents that they're taking care of as much as your staff do. And so that's quite challenging as well. Although we try and aim for consistency with care staff within the home, you can't always guarantee it because every home's the same as mine. I am not the only home manager stressing with GPs, stressing with staff, stressing with relatives ringing up. I mean, I've got 101% time for my relatives because I know that if it was our parents, you and I would both be exactly the same, if not 10 times worse.
Yeah. So, you related to your staff being uncomfortable, your staff being afraid.
Mm-hmm.
How is that impacting their mental health, and what procedures are you actually implementing proactively to try to support that mental health structure? Because obviously mental health is very important
It's
for
massive.
even outside of a pandemic environment, in regards to supporting not just their physical safe systems of work
Mm-hmm.
in regards to health, but their actual mental health as well. Because if they're happy, they're proactive. If they're not happy, they're super negative. So how are you building that structure in regards to a positive mental attitude in your workplace?
Okay. So from a company level, rather than on a personal level first, our company have opened up a HR help desk
Mhm.
for staff to be able to contact, and that opening time is lengthened from 8 o'clock in the morning till 10 p.m. at night. They have put apps on that we can access regarding mental health, and all the relaxation apps, they've opened those up to the staff as well, because some of them you have to put a cost in, but they've done it so that we don't have to pay for these apps, so they're able to maintain their well-being. For me, from a personal point of view, it's important that my staff are getting good rest when they're away from the home. It's important that they're eating, drinking well, that they're taking care of themselves. I try and do a staff brief every day with the up-to-date information from the government. I go on a call every day with our area directors to clarify all the updates. I can't tell you how many emails I get in a day from various areas, including Public Health England, the local authority, and from our senior parties within the company. But I try and be as upbeat as I can, and I hope that my staff would agree that I'm very supportive. There's only so much food you can give people to keep their motivation going, but they see the kindness from other people that send in, like like the headbands into the home, so that the masks aren't rubbing against the ear. We had a great company that made us a load of face visors.
That-
So we already had face visors in place, but I had a lovely lady on the phone offering to make the staff scrubs. So they see the kindness from outside. And if I have a relative on the phone and it's really, really positive conversation, I will pass that on to the staff straight away. I mean, as you know, that we have had some deaths, sadly, but some of the people that have sadly passed away, and we had some really, really nice comments from the families because they've lived within the home for such a length of time. It's amazing. And my staff team, I say to them every single day, regardless of the media, regardless of what you hear on the news, you guys hold your head up high because you are doing such a fantastic job, and I'm so super proud of you all. And they know that they can ring me anytime because I am on call for that home 24 hours a day, 7 days a week.
yeah.
So they know that they can ring me.
It was interesting when I was watching the media today. Sky News, BBC, etc., etc., that it was the first day that I actually saw they included healthcare workers on top of the NHS workers who'd actually died. So how has that recent information affected you as an individual, knowing that some of your peers around the country are actually dying from this horrible disease, on top of what, the deaths that have been day by day reported by the NHS? How does that make you feel that you're now included in those figures so people actually know the challenges?
I think, to me, it's a positive. Obviously, it's negative in the sense that people have actually lost their lives. Are those people just a statistic, or are they actually going to look into the areas that those people were working in, the provisions that were in place, etc.? I'd hate to think that they are just going to be a statistic on when the government and everybody else look back. From my own point of view, I cry a lot at home. I vent at you a lot when I speak to you as well.
That's what little brothers are for, so that's what I'm here for.
Yeah. So, because it's the harsh reality of it all, and what you actually do.
Yeah.
It's like wartime nurse. I mean, I've got the privilege of looking after some of my residents that are over 100 years old. So they've lived through the wars, and obviously they've seen the country on its knees and through crisis of like wartime, but never have they lived through a like a biological warfare, if you like, where they've had to fight with everything they've got because they are the most at risk group.
Yeah. And this is obviously concerning for us on a personal standpoint, because our father and mother, one is just south of 70 years of age, the other one is 4 years north of 70 years of age. So obviously that's got a personal concern of us. Okay, Sam, thank you very much for joining me tonight and being willing to actually share your story, because obviously you're one of the things that keep me awake at night, because knowing that you're working on the front line, I'm super proud of you, yeah, as a brother, but also as a member of the United Kingdom. We're all super proud of you, regardless of what people say in the media. You're doing the best you can do in a terrible situation. Yeah. So to anybody who watches this, and I hope people do watch it, share stories like this in regards to the challenges people are facing every single day, but the positive approach that they're actually going out to work every single day to protect you, your family, and the whole of humanity during this terrible time. This is Steve from Safety Inspired Life in association with Achieve Training and Consultancy. Take care. I'll see you all soon. Bye-bye.